not removing those barriers that many people have ahead of them in order to achieve the outcomes that they seek. And that's where personalised care comes in. We need to start with an approach that asks what matters to people, not just focuses on what's wrong with them. We need to change the clinical conversation. We need to engage with people in a different way. We need to fundamentally change the relationship between people and the system, but also people and their own health and care. 40% of people say they don't understand the health information they're provided with. 40% of people say that they're not involved as much as they would like to be in their care and support. So we can do that by engaging people differently, by creating holistic care plans as well that look across people's needs. We've got a very siloed approach to health and care. We assume someone has mental health issues on a Tuesday and cancer on a Wednesday. But of course, somebody living with mental health issues and cancer is living with those two conditions every second of every day. And actually using personalised care and support planning, creating the opportunities to look at somebody's life really carefully is one of the keys here. And then beyond that, how do we support people? How can we deliver services in an innovative way? And that's where social prescribing comes in. And over the past few years, social prescribing has been growing as a movement across the country. It's started many years ago, in probably, in some areas about 30, 35 years ago, Bromley by Bow, work that was being done by Michael Dixon in Clumpton in Devon. But also many pioneers across the country have used opportunities through types of social prescribing to connect people to their communities. But we're now seeing the opportunity to make this happen at a large scale. And 2 years ago in the NHS long-term plan, we committed to embedding social prescribing right across the country in the NHS. So social prescribing being available in every primary care network, in every GP practice. And we're ahead of our target with that rollout. We committed to have 1,000 link workers in place, embedded by March of this year. We've actually got 1,500 link workers. And link workers have been doing an amazing job during the pandemic. Many of them have only just started their roles, and they've been working tirelessly, supporting those people who are really struggling in society, creating connections to the valuable assets that are in the communities and the places around those individuals. And we're seeing benefits across all sorts of areas as well. And alongside the work that NHS England are doing, the Secretary of State established the National Academy for Social Prescribing, as Julie said, a couple of years ago. And at the National Academy, what we want to do is we want to really spearhead the championing of social prescribing, making more noise about it, changing the culture so that people recognise that social prescribing is a force for good and are wanting to engage in it. We're also trying to build collaborations. We've developed our Thriving Communities Network, which has got a huge number of followers now. People are engaged in all sorts of projects across the country that we've sponsored, and we've got a growing community of people that are following now. We're also looking at national innovations through an Innovation Accelerator programme. We've been working on the evidence with a collaborative of universities to improve the evidence base. We're working across multiple agencies of government to build collaborations, whether that's in the Department of Culture, Media and Sport or the Department for the Environment. And we've created a focus on 4 zones of social prescribing. The first being arts and culture, which you're discussing today. The second being the natural environment. Third being sport and exercise. And the fourth being advice and guidance and support. And these 4 zones create the opportunity for social prescribing to thrive. We need activities to be happening in all of those areas because that's the sort of support that people are going to benefit from. Sticking with arts and culture more specifically, I think we've got a massive movement, not just domestically now, but globally. We've got a significant number of people around the world that are following social prescribing. And through the National Academy, we launched the Global Social Prescribing Alliance, working with the WHO and the United Nations and the World Health Innovation Summit. And we're creating networks that are now embracing the opportunity of embedding arts and culture in health across multiple pathways of support for people. Some of the great examples that we've had over the past year have included the fantastic project called Art by Post, and that we're due to launch an exhibition in the South Bank Centre tomorrow called Home and Hope, which is been a programme that has enabled people to receive art packs through the post, designed by professional artists that they've been able to engage in from their own homes. So a fairly low-tech opportunity for people. But we've also seen fantastic support for people living with dementia through community choirs. We've seen the English National Opera launch their Project Breathe, helping those recovering from COVID to improve their respiratory health, with the addition of opera singers that are providing people with singing techniques. And right across the country, there are a myriad of examples of communities coming together to embrace arts and cultural activities. And I know there's going to be a number of those examples shared today from Greater Manchester. I think that the work that you've all done and the opportunity to demonstrate how effective this process can be to the rest of the country is huge. You are pioneers in a lot of the work that you're undertaking. And I think that what you've been able to do in Greater Manchester is demonstrate that things can be different, things can be really progressive, and people's lives can be changed with the simplest of interventions. So hopefully that's a bit of an overview of the way in which social prescribing is growing. You are all part of a huge movement now, and we are determined to continue the good work of social prescribing, both through the Academy and through NHS England. Over the next few years, we hope to have 4,500 linked workers in place that are going to really provide a universal service. We hope to improve the level of funding that's available for voluntary community faith social enterprise organisations. We want to improve the evidence base, and we want to create better collaborations, because as we face some significant challenges in society, I'm confident that social prescribing is one of the key tools that we have to deliver good health and well-being. Thank you very much. Julie, back to you.
Thank you very much, James. There is an opportunity to ask questions. If you have a question throughout the session, actually, if you want to raise your hand, or if you want to put the question in your chat. Sorry, I should have said that at the beginning. I have a question for James, actually, and then we'll throw it open for about 5 minutes or so. As I said at the beginning, we are looking at how we go beyond social prescribing in Greater Manchester. So we're looking at how we work with a number of pillars, including housing, arts and culture, physical activity, debt relief and debt advice, as some of those. And one of the biggest challenges we feel we have is how, in this kind of holistic approach to social prescribing, we work with the voluntary sector and community organisations and start to look at how we resource the destination activity. So how we make sure that we're not passing a burden onto the voluntary sector for delivering the things that people are prescribed, essentially. So I wanted to, I know this is a huge hot potato and it's something that we're all grappling with. And I think I'd like to hear, James, from NAF's point of view, what's your current thinking on that, and how are you grappling with this yourselves nationally?
So yeah, it's a really important point here. I think firstly, we've got to recognise that whilst, as I mentioned, elements of social prescribing have been happening for perhaps 35 years, this is a relatively new venture for the NHS, and it's a relatively new venture for the country. And consequently, it's going to take time to embed the right processes and environment in place. I think we also, we're facing really significant challenges in the NHS, and getting that shift to be more proactive in terms of the support that we provide to people is quite a huge challenge, because obviously today we're facing the consequences of lack of proactive support perhaps 10-20 years ago for certain communities. So consequently, we've got to make that adjustment over time. In terms of the specifics in relation to funding, I think firstly the point that I'd make is that the focus should not just simply be on the NHS. We're talking about issues for the whole of society. I think other departments, other parts of society have a role and responsibility to play here, because as we're saying, a lot of the issues that we're seeing people face are not medical issues. So, communities and local government in terms of housing, the natural environment, education, all of this is an issue that the whole of society needs to embrace. So I think we need to look at funding across multiple organisations. I think for me there's three levels, which I think is helpful to look at it. The first is, what we have in society that makes us well as human beings. We all need access to green spaces. We all need parks with recreational facilities. We need libraries. We need sports centres. All of those things that are part of society that enable us to access those things. We've got to have. At the top of a sort of triangle, I suppose, we've got services that probably should be commissioned formally by the NHS. So if I mentioned Project Breathe, for example, if a provider is looking to support 50 people with respiratory conditions, then maybe commissioning an arts-based organisation to deliver a programme that's structured like Project Breathe is really, really important. And I think that should be a formal commissioned relationship. I think the big area to focus on that we need to fix is the bit in the middle, the stuff that isn't really specialist enough to commission and is a bit more than just having that infrastructure in place in society that we expect. And there, I think we need to look at models of shared investment. So the NHS, local government, private sector bodies, and other government statutory bodies are coming together to create funding structures that enable money to be accessed by the voluntary community sector. And I think that's key, and that's one of the things that we're going to be working on over the next year, is how we can implement those shared investment funds across the country, because I think that will hopefully be a starting point of a different way of funding this. Quite a long answer, but it's a complex area, Julie, as you recognise.
No, it is, and thank you. And I'd be really, welcome a conversation with you about how we might be able to take that forward in Greater Manchester, because it's something we're starting to think about now. And Annie Harrison, you have a question. Do you want to unmute yourself and ask that?
Yeah, hi.
Hi, Annie.
Hi, Julie. Nice to see you both. I'm a lecturer in public health at the University in Manchester, and I teach a module called Arts and Public Health. What would you say, James, is the role of arts and within the public health sector, and what would you say to Masters in Public Health students about enrolling for the Arts and Public Health course?
Great course, and thank you for championing this sort of approach as well. I think arts have a huge role to play in public health. I think that the interesting thing here is just how much we need to embrace a new way of thinking around this. I mean, this to me is a big revolution in how we perceive health and well-being. And we know as human beings, arts and culture plays a big part of our lives, but we tend to forget the impact that it has on our health and well-being. We know that going to see a concert, for example, makes us feel good about ourselves. But what about participation in music? What about going one step further and music being an intervention in our lives? If we're living with dementia, for example, having music as a way of calming us, as a way of helping us to eat, helping us to exercise, helping us to be motivated. So I think we're starting to see the transition of those things that have happened around us while we've been concentrating on our health into a greater awareness of the arts and culture as part of our health and well-being regime. And I think that's got a long way to go in terms of developing it so that it is completely on tap. But I think we're starting to get there with this movement. What I would say to your MA students is that I think that they are at the forefront of learning something that's going to become a huge currency in health over the next 10 years. And I think that in many ways it's crucial to be finding new opportunities to connect arts and culture with health and well-being. So, you know, any studies that they can do at the moment to improve that evidence base, I think are huge. It's a good time, I think, to be studying this area. Is that okay, Annie?
That's fine. That's exactly what I wanted to hear. Thank you. Thanks very much.
Does anybody else have any questions? We've got a couple of minutes. Any final questions for James you'd like to ask him? Put your hand up if you have. If I do, if no one else has. So I can't see anybody else putting their hand up. Oh yes, there's one. David.
Hi, I'm David Allen from Skylight Circus Arts in Rochdale. We're a small charity that provide circus skills and training and performance opportunities for people of all abilities. A large part of what we do is around circus with a purpose, so it's helping people that have health issues, whether that be mental or physical, and that's why I'm here today. My question is, how do we legitimise the work that we do to the wider NHS group that aren't perhaps on board, but also to, I suppose, people that spend the budgets or provide the budgets?
So I love that circus with a purpose phrase, actually, David. That's great. So I think the thing here is this is about, you know, what matters to individuals, and I think we've got to get over this clinician-led or commissioner-led view of what matters, and commissioning it through their eyes. You know, what works for one person is not going to work for another individual. I heard lots of stories over the last year of things that have made people better and that have improved their lives. And many of them are things that I would be absolutely horrified at doing. I mean, water Pilates, I mean, who needs that in their life? But, you know, for a lot of people, they have embraced things that have been transformative. I love the idea of circus skills being used, and actually saw some great photographs from one of our Thriving Communities programs, actually, of a 87-year-old in a trapeze swing, having a fantastic time. So what I would say is, I think it's finding the core aspects here. It's beyond the surface of what it is, you know, whether it's knitting or it's park run, or it's juggling. You know, the core is how are people engaging with it? Is it improving their experience of care? Is it improving the outcomes? So patient-reported outcome measures being quite key here. And fundamentally, I think the commissioner is going to be looking for value and impact on the system. So have the people that have attended your programme reduced the number of GP visits that they're having? Have they reduced their trips to A&E, their moments of crisis? Are they reducing their medication as a consequence of the improved well-being and health through the programme? So I think trying to create something that commissioners in the NHS will understand having value for them is really, really important. And the other aspect here is, I think, the collaborations. What we're seeing is those programmes that are most successful are the ones that have joined together with other community groups locally. So rather than going it alone, a community coalition coming together to present to the NHS what they can offer, I think is going to be key to future support decisions. So, you know, on the ground locally, I've seen great examples where the church and the mosque and the food bank and the dementia cafe and the community choir and the library and the walking football group have all come together to say, you know, this is a package of support we can provide. And then those individual strands just have that greater inflation. It gives a bit more of an emphasis of what's going on. I'd
just like to add to that, actually, for David, that You're going to hear in a little while Angela from iThrive talking about the work with children and young people, and particularly the evaluation kit that we've collaborated on. So that enables you to, a cultural organisation, a creative organisation, or a community group, in fact, to evidence outcomes through social prescribing work, so through engagement, because we realise that one of the biggest barriers to commissioning and also to cultural groups being offered as destination activities is the lack of, well, not the lack of it, but the perceived lack of evidence in that it works. And so we've created a way for organisations who have little experience or don't have access to academia, for example, to be able to evidence in a robust way, and using outcome measures that, for example, a mental health service would recognise as valid. So Angela's going to be talking about that in a while. I know we've kind of slightly gone over time. There's one last thing actually I just want to ask you, James, and that's about children and young people social prescribing, because this is an area that is growing rapidly. We're involved in Greater Manchester in a college pilot, and we're using the evaluation kit that I've just mentioned, and we've also got a PhD student attached to it, so we're going to have some really good, robust evidence there on the benefits. But can you very, very quickly just tell us about the NASP's plans for developing children and young people social prescribing?
I think it's an area that we need to really rapidly increase momentum in. So I think what we're seeing is three core groups that really need to benefit from social prescribing. I think a lot of the social prescribing has been focused on older people and people living with dementia, living with frailty. I think we've got a significant group in the middle-aged people, usually around 50 years of age, people that are starting that process of developing perhaps one long-term condition that then can turn into two or more, and create problems for them 5-10 years down the line. So getting to that group earlier is really important. And children and young people, I think we've got to embrace that. There's been far too little investment in children and young people. We know that it's the group in society that's the most lonely, and we know that there's significant challenges with the impact, disproportionate impact that the pandemic has had on young people. So what NASP is doing is looking at scoping out a number of programs of work through its Thriving Communities programme. We're looking at focusing on that through our Innovation Accelerator programme as well, to create new ways of engaging with that group of individuals. And I think for me, it's got to be a primary focus of all groups out there, and looking at all age, but specifically how can this thing that we're doing be adapted for young people is the question I think everybody has to ask.
Okay, thank you, James. Thank you very much. I know you're unable to stay for the whole session. You're going to have to go quite soon, but thank you very much for your contribution. It's been really good to hear about what NASP is doing, and I think here in the Northwest and Greater Manchester, there's lots of ways we can collaborate with NASP going forward. So thank you very much.
Thank you, Julie. Thank you, everybody. Lovely to join you.
Thanks a lot. Next on the agenda, we did have Dr. Jaweedha Idhoo. She has recorded us. Unfortunately, she has no internet access at the moment. She's WhatsApped us a video, which my colleague Claire, at the very last minute, is just trying to get into the right format to be able to share with you. I'm going to have to busk a little bit here because I've just been texting people frantically. Clive, would you be able to go? Would you be able to go next to give Claire a little bit more time?
Yes.
That's brilliant. Thank you very much. So we're going to swap things around a little bit. We're going to talk to Clive Parkinson next. Thank you, Clive. You're a consummate professional. Clive is the director of Manchester Institute for Arts, Health and Social Change, and he's also the author of A Social Glue, which is a report that we commissioned from Clive to look at the links between culture, health, social and health inequalities, and how we might take some really important work forward in Greater Manchester as a legacy of Great Place. And it's actually shaping up to be the most important piece of work that has come out of Great Place, Greater Manchester. So again, we will have time for some questions. So if you have questions for Clive, please pop them in the chat or raise your hand. I think we've solved the problem of the feedback people were getting. I think it was actually James's mic. Over to you, Clive, and thank you very much for just stepping in a little bit earlier than you were expecting.
Oh, it's absolutely fine. Hope you can see me all right, everybody. Nice to be here. I am aware that not so very long ago I launched a social glue. So I'm desperately not trying to repeat myself too much, which is difficult because there are some key points I want to make. And the other thing is, years ago, I worked with people around the Northwest region developing manifesto for arts, health and wellbeing. And I used a piece of poetry in that. And I'm aware there are two people in this room today who are going to hear that poetry again. So, damn, I was trying not to repeat myself, but it'll be fine. So what I'm going to do is just think about what a creative health city region might look like. And I want to begin with a slightly edited version of the writing of a poet, Julia Darling, written shortly before she died in 2005. Now, it's not from Greater Manchester, it's from Tyneside upon England, and this is called A Manifesto for Tyneside upon England. Slightly edited version. Friends, I'm inventing a life in which your ingredients are returned to you. Our lives are run by car parks, carrier bags, suits and credit cards. So this evening, I'm removing power from our city leaders, and the city shall be run by its artisans and makers, by bread kneaders and stonemasons, sculptors and chocolate fanciers, by egg painters and flower arrangers, blacksmiths and conjurers. The old leaders shall go to the great hall where they shall be asked to cut up their suits and make them again. And I'm confiscating all luxury flats and offices and giving them rent-free to artists and makers. All property developers shall report to the great hall for retraining in creative play. All supermarkets will be barricaded, all chain stores closed. Everybody shall be taught the history of their street. Joan Miro, the great Catalan artist, said that to be truly cosmopolitan, we should begin by learning about our home. There should be no brown signs, no information stands, no mobile phone centres, no mobile phones. We shall each learn a disappearing language. And there shall be compulsory napping from 2 p.m. to 3 p.m. each day. Workforces must be provided with blankets and mattresses. Musicians from the hills shall play them to sleep. No one should own more than they can carry. We shall pull down Eldon Square and rebuild it as it was. I shall rebuild Handyside Arcade. We shall pull down Swan House Roundabout and make the Tyne Bridge pedestrian. Each of us will learn a contemporary dance. We shall not travel, although we may have pen pals, and we're free to imagine travel. The air of the new city shall smell of pies. There will be many bicycle repair shops and free bikes. The city shall be filled with the sounds of making, of sparking metal, of whirring mines, of fresh cheese, of new poetry. We shall all discuss small things. There shall be lesbian happy hour between 6 and 7. Schools will be small, doctors will be cheerful. Everyone shall make their own coffin and use it as a table. We shall be encouraged to grow English apples and raspberries. Plain English will be used at all times. Porridge and soup will be plentiful, and visitors will come in droves. They must bring gifts to the Great Hall, perhaps food, chocolate, or wine would be appropriate. These gifts shall be shared equally. You cannot enter the city without a gift. We shall know our saints. We shall know our devils. Friends, I'm inventing a life in which your ingredients are returned to you. Our lives are run by car parks, carrier bags, suits and credit cards. This is my homage to you. So, thinking about the recommendations set out in a social glue, yes, we want it to be realistic and think through the steps needed to make creativity and culture part of all our lives. But we mustn't lose sight of our passion and our vision beyond the day-to-day obstacles. We launched a social glue back in May, and over the days that followed the launch, I undertook a stem cell transplant that saw my body reduced to the most vulnerable of states. Writing a social glue, I knew that this was on the horizon, and my treatment and completing that work was a priority for me. Not as poetic as Julia Darling's ingredients, perhaps, but you could argue that both these things are labours of love. Imagine through difficult personal days, a love born of deep-seated belief and the power of creativity in all its manifestations, and a clarion call to make changes, both utopian and practical. So I'm happily back here today thinking about increased public awareness and participation in culture and the arts during the pandemic. People are beginning to get the arts in relation to their own and sometimes their community's well-being, which is amazing. I see all this as evidence of our psychological and emotional progress and our potential. Historian Mary Beard is cautious, however, that the cultural sector has been embraced by the idea of the arts simply making us feel better during the pandemic. She argues that it's so much more than just feeling. The real reason, she says, that we need the arts is because we needed to see what we're going through. What did we feel and why? And that's critical. She makes very critical points. And rather than just branding around words like well-being and resilience, getting access to our own and others' creativity helps us make sense of the world and perhaps be the drivers of social change. A social glue hints at the possibility of us thinking beyond ourselves, blurring the messy boundaries between the amateur and the professional, and the places and spaces where health and social change might happen in communities, neighbourhoods, and not just clinical or big cultural settings. Just like Sir Michael Marmot's most recent review of the unacceptable inequalities in the city region, the Greater Manchester Independent Inequalities Commission report fails to equate culture and creativity as a means to achieving health and well-being. So while Greater Manchester has become the UK's first Marmot city region with a strategic commitment towards creating a fairer, more equitable society, we need to make the most of this wider public receptivity to our creativity right here and now. And that's why a social glue challenges us all to work towards becoming a creative health city region. Now, more than ever, we must lobby for culture, creativity, the arts, whatever we're calling it, to be included in strategic thinking and funding, not as a universal basic service, but as a fundamental human right, not just prescribed when you're poorly, but a glorious part of life and an upstream influence on a life lived. Our thinking needs to turn into conversation, discussions into planning and action, all of it contributing to transformation in our communities. Persistent and poisonous inequalities, seen alongside the inclusivity that participation in culture and the arts potentially offer, is compelling. Opportunities for reimagining the ways health and well-being are nurtured through cultural investment in all our communities is here and now. Those 8 recommendations set out in a social glue centre on, I think, very achievable things. Loud and intelligent public debate, strategic leadership and investment, our rich cultural offer on the ground and way up in the gods, the possibilities of our shared imaginations, and the untapping the power of diverse people. What might Creative Health City Region look like in the next 5 years, in the next 10 years, or better still, a generational leap of about 30 years? God knows. We need to be thinking beyond our own lives and that of our children and our children's children, to quote the advert. Perhaps it's by focusing on inequalities and environmental health that the potency of the arts will come into their own over the coming years. You may think that Julia Darling's manifesto was way too utopian. You may find the aspirations sat out in a social glue and the Manchester Declaration just another report, just another piece of paper. But the evidence is out there, and it's rich and it's compelling, and it should be used as part of our rallying cry to leaders that there is a powerful and growing movement that's essential to healthy and emotionally intelligent communities. Over the coming months, I hope we can dig deeper into some of the thinking in a social glue, and I'd really love to hear from you and the groups of people you've worked with, because I've been out of the loop with those of my ill health. I'm really keen to speak and hear and know and learn from people. And if you're waking up on some kind of bright, sunny day in the not too distant future, and you realise that we were, in fact, living in that healthy, equitable time, it's happened, we don't know how it's got there, what might you see? What might you hear, smell, taste, feel? Why would it be the place that we want to be? What are we aspiring to? And if any of you out there, or groups that you work with, or people that you know, would like to contribute a poem, you might write it alone, together. You might write a paragraph, you might write a song, you might take a photograph, you might do a little drawing or something. I would love it if over the month of October, you could brighten up my inbox with your own versions of manifestos and aspirations and what this, not new world, it sounds too sloganeering, but what this place might be, particularly thinking about Greater Manchester, and just email it to me at the Manchester Institute at gmail.com. And I just want to finish with that one line again, because I love it so much, from Julia Darling. Friends, I'm inventing a life in which your ingredients are returned to you. Thank you.
Thank you very much, Clive. I don't think anyone's going to dare to actually ask you any questions, but if anybody has a comment or a question, we'd love to get that now. I'd like to add a comment that obviously it's an absolute delight for me to have been working with Clive, and we are, I think, both kind of passionate, romantic, but also pragmatists about this work, and we're really looking at ways we're taking this forward as part of Greater Manchester's commitment to people living healthier, better lives, and we want them to live happier and more creative lives as well, and we are finding ways to make that happen. And so there will be invitations in your inbox to take part in conversations, not consultations, conversations, as soon as we can make that happen. Somebody wants the email address. Is this right? The Manchester Institute at gmail.com. Right, I've just put that in. I'll just put that in the chat. Would anybody else like to make a quick comment or ask a question? I can't see any hands up at the moment. If not, I will. We have got a little space at the end for a quick chat. So if not, I will move on to Jaweedha's intervention. Claire, is that possible now? Are we able to do that?
Should we try it, because we haven't
yeah,
tested it, so let me try and...
So please bear with us. This is an experiment. It's literally something we had to, Claire's been working on trying to get this together, because these things happen when you use tech. Just to say that Jaweedha Idhoo is a GP at the Albany Family Practice, and she's the clinical champion for personalised care for Greater Manchester Health and Social Care Partnership. She's chair of Viaduct Care, the Stockport GP Federation, and the North West BAME Regional Assembly member. And she is a massive champion for our area of work. And she is for the work that Clive and I are taking forward, she is our clinical expert. And so she's working with us on taking this work forward. So let's see if Jaweedha's face is distorted on that. Let's see if we can get you to hear this. If not, I will I will make sure you get this sent to you. So let's have a go.
Hello, good afternoon, everyone. It's Jaweedha here. I'm a GP at the Albany practice, and I'm a member of the People and Communities team at Greater Manchester. I'm the Personalised Care Clinical Champion. Sorry I can't be with you today. We have some technical issues with Wi-Fi in Cornwall, but I would just like to take the opportunity to perhaps talk to you a little bit about how arts and culture can impact on health inequalities. It can impact incredibly powerfully, and certainly in terms of the broader determinants, what we've seen with multiple studies, and there's been a fantastic collation of information, over 3,000 studies in fact, by Dr. Daisy Fanco from the University College London. In there, they looked at, for example, groups of young people who'd been subjected or exposed to violence, and found through music and art and engagement that their levels of self-control improved, as did their self-esteem. When we can actually focus and improve access to arts and culture, music, museums, dancing, singing, it has a far greater impact than just writing a medical prescription. If we're really going to make things happen in Greater Manchester and become the Marmot City we wish to be, and also understanding how the Live Well model can underpin some of this, we have a fantastic opportunity with our 13 hospitals, our 200 GP practices, and a vast array of link workers supporting social prescribing. What I've come to realise both at face-to-face level and at strategic level is that we cannot just use health as the only option, or medication as the only option in supporting individuals. The way to systematise things is to work with those health organisations, with those GP practices, and ensure that although we recognise conditions like diabetes, weight is a big problem at the moment coming out of the pandemic, and the impact that obesity had on death rates from COVID and ventilatory rates, we know that if we start to use arts, culture, engagement in activities, we actually improve people's mental well-being, we reduce levels of depression and anxiety, and we probably improve, therefore, people's adherence to medications and treatments. It's not a one-size-fits-all, but it's making sure the opportunities are available to people to do this. And the way I think health can do this is how we design our pathways for patients. So both in hospitals and secondary care, in primary care and general practice, we follow guidelines in practice. And those pathways and guidelines will say, prescribe this drug or do this thing for this person. And in order to standardise and reduce variation, those sorts of examples help to reduce variation and inequalities in terms of outcomes for patients' health. However, the part that I think we haven't embedded and needs to be embedded just as much into those pathways and those guidelines is how we introduce arts and activity, music, and the opportunity to reduce social isolation, improving well-being for people. We will see how that can really have a significant impact. I hope in my role, and certainly working with Julie and the rest of our team, and working with our colleagues in primary and secondary care, that we can really start to focus on those pathways and guidelines so we really embed those changes in. That's just a flavour of what I wanted to share with you. I hope to be doing a lot more work with the Arts Council and the arts and sector in trying to ensure that we make those changes tangible and happen at the GM footprint. Thank you.
Okay, virtually, thank you very much, Jaweedha. I know she's sitting in a cottage with no Wi-Fi in Cornwall. Who knew? So Jaweedha is an amazing champion, as I mentioned before, for this work. And I think out of great pace, really, one of the things we've done is really identify her as an advocate and as a partner, as a clinical partner. We're working so social glue, culture, health and wellbeing, that work is now being driven between the combined authority and the health and social care partnership, which will become the integrated care system in April next year. And Jaweedha, as I said, is our clinical champion for that work. So we've got a lot of work going on with her going forward. Oh, somebody's got their mic on. Right. I've just found them. Okay, so I want to move on now to Angela Daniel. So one of our case studies for Great Place, and I'm going to tell you about the website and where you can find the case studies towards the end of the session, is about children and young people within the mental health system, and how we know there's a huge crisis in children and young people's mental health, and how culture and creativity can really help to address some of the issues that children that they are facing at the moment. And as I alluded to before, we found there were a lot of barriers, and some of those barriers were about how we measure that there's actually been an improvement. So obviously, without saying your presentation for you, Angela, I shall hand over to you. So Angela is the Greater Manchester I Thrive Programme Manager. And she's going to be talking to us about what that is and how we've been working together and what's going to be happening next.
Great, thank you, Julian. Hi, everyone. I'm glad there's a little bit of a break between Clive's and mine. I was a bit nervous of following Clive's presentation. I've kept on, I've put Kat Taylor's name on this presentation as well, because really it's to acknowledge Kat Taylor's done most of the work around our arts and culture part of the programme, and it's good just to acknowledge that here. So what I'm going to do is start off a little bit about what Thrive is and what we're trying to implement across GM, and then how arts and culture is actually pivotal to our mental health and wellbeing of our children and young people. So about 3 years ago, our commissioners in the CCG decided that we wanted to implement the Thrive framework for system change across Greater Manchester. So I'm going to quickly go through what this means, and I'll ask, you can have any questions at the end if there's anything that's not quite clear. So what we're looking at is trying to really rethink our current mental health system. So if you know anything about CAMHS, it's quite tiered, and that doesn't always make sense to other professionals, and a lot of children fall in between the gap. And we've also kind of gone to the stage where it's mental health services is automatically our response to anyone with any mental health or wellbeing issues. And what we're saying is there's a lot more out there that we need to be thinking around our children and young people. So what we've decided to move to is, in this framework, it moves more to needs-led rather than diagnostic-led. So what does that child and young person need, or that family need, and what do we have within our system that can help and support that family, that children and young people and their family? So any child or young person who are in the needs groups of getting help or getting more help are children and young people who need an evidence-based intervention. And that can be delivered by CAMHS, but it can also be delivered by the voluntary sector as well, and local authority. Any child or young person in the advice and signposting is children and people and families who need to access something that can help them to help themselves. So that can be websites, can be apps, it can be certain services, it can include arts and culture, and I'll go into more detail about that. But it's really around accessing something that can help you to help yourself. Children and people in the thriving, that's about 80 to 90% of our population. And that doesn't mean these are children and people who are skipping through fields, high-fiving each other in happiness all the time. But actually, when things get tough, they can actually get that support and help from family, friends, communities, etc. And again, I'll go through more detail into these. And children and people in the getting risk support is a very minute group, a very discreet group of children and young people who may have been in getting help or more help, but haven't improved, or may have got worse and remain a risk to themselves and others, or wouldn't engage in that form of help. The services and the system that we have out there doesn't suit their needs and remain a risk to themselves and others. And it's a way of us thinking differently and working with those children and young people, where our mental health practitioners will support someone who actually better engages that young person. That could be another worker, that could be a family member, football coach, art class, drama, etc. Whoever best engages that young person. So that's the system about rethinking about those needs. But what does that mean? There's principles alongside the Thrive framework, which it provides a common language that we all understand. So it means that children and families, and also the workforce, regardless of what workforce and whether in the voluntary sector, we all understand getting advice and signposting and getting help, etc. It's needs-led rather than diagnostic, so we're not chasing diagnosis all the time. And shared decision making is at the heart of it. And I'll go into more detail about that, because for shared decision making, we need more choice. Proactive prevention and promotion, which is pivotal for arts and culture in our thriving part, and I'll go into more detail. Partnership working, which we're all trying to do. It's outcomes informed, so it's talking about endings from the beginning and understanding if things aren't working. It's reducing stigma and accessibility, so how accessible is our whole mental health system, not just mental health services. So thriving. This is where we all have a role. Every single one of us has a role in thriving. We should be thinking around promoting mental health and well-being. How are we supporting our children, young people and families to access things that we know can make them mentally healthy and well? We've got the 5 ways to well-being. How emotion friendly are our environments in our services? And are we actively promoting mental well-being? So our feeling from the Thrive point of view is every single person, regardless of your role, has a role in thriving and promoting well-being. In getting advice and signposting, there's a work that's been going across Greater Manchester and every locality about mapping what is out there, what is that, and what does it look like within each area. And within that is what arts and culture and voluntary sector offer do we have for our children and young people, and how do we think about that being just as important as other services, and how are we evidencing that? And I'll go into that a bit more. But also we know some children and young people prefer digital, so there's a little bit of for our locality to think about what digital offer do we have for some of our young people. We have advice and signposting offer that helps people within these localities understand their own role in advice and signposting. So again, there's a feeling from us that everyone has a role in being able to give a bit of general advice, but know where to signpost our children, young people and families. Our getting help and more help, again, is about mapping what we have out in our system and what's evidence-based interventions, are compliant, etc. And our risk support is around thinking, apologies. Always happens, doesn't it, when you're presenting? So our getting risk support is about how do we get social care and CAMS especially to work together towards those young people who don't actually formally engage in our services and remain risk to others, or have and remain a risk to themselves and others. Moving on, where does arts and culture fit in this model? Well, for us at the very beginning, when we were thinking about it, is Kat actually came to us and said there's lots of evidence around arts and culture. We should be thinking about this across as a big programme strategically, and absolutely right. We need more choice and more evidence around arts and culture, and we needed to bring it in throughout the whole of the model. So at the beginning, we were thinking, oh yeah, that fits really well with our thriving and advice person, but actually it fits in every part of this framework. It does fit in to that promotion and prevention and that general well-being that we have. It does fit in really nicely in the getting advice and signposting. But also we did some proof of concepts alongside with Julie with our CAMS services in GM, where we used arts providers, provided an intervention for young people who were in CAMS services, so they would have been in getting help and more help, with really, really good results. So they fit there, but also they do fit in the risk support, because sometimes arts and culture and different organisations within that actually engage with our young people really well, better than some of our services. And an example of that would be Unity Radio. You know, so for us it fits throughout, and it's really, really pivotal in every part of our framework. When we're thinking about it within the system, how can we be thinking about it? And I suppose this links with the social prescribing that we were talking before. How does it link in our single points of access, our single points of navigation? How they're thinking about social prescribing or signposting our children and young people into different activities that we have available within our localities? How can we actually think about young people accessing this while they're waiting sometimes for medical support within CAMS services, and that can actually sometimes reduce time waiting. It can help as you bring it into people's services, a little bit more of that playful part of us into our services. We've seemed to have lost that a bit, and that creativity. So there's a thinking about bringing it into the whole framework. But we know it's important. But this was I thought it was quite an interesting statement, really, because it's about, we know it's there, we kind of know it works, and what most people say, so what? So what? How are you evidencing? What's the impact of it? And we need to work together to collect our evidence, all of us together. And I think that's a little bit that leads into this evaluation kit. So, we need all of us together here, bringing out those stories and the evidence findings and those case studies that are so powerful, and really bringing that platform for a big, strong voice for arts and culture and how it works for our children, young people and families. So we know that arts organisations are good at using creative activities to support children's mental health, and we know commissioners are good at using evidence to identify needs for services. And that's what we tried to bring together when we created the GM Youth Mental Health Arts and Culture Evaluation Kit. Just runs off the tongue, that, doesn't it? So with the partners, as Julie said before, we worked together with a great place, and then also some wonderful colleagues across in our arts and culture, from Arts Council, Lime, 42nd Street, to name a few, but there was a lot more than that. And we decided at the very beginning, well, what can we bring in that works for our mental health services that commissioners look at, but also would be able to be used by our arts and culture world to evidence the impact and improvement on mental health and well-being. So that was the kind of attitude that the mental attitude that we went into for it. So we met together, we had a few workshops, and we decided that, well, okay, we're going to go for some minimum, what can we all together collect minimally to evidence impact of arts and culture? And we split it into 4 areas. So we had the demographic data that we all collect quite well. And so anything in bold was like the minimum that we should do. And then the national metrics was, okay, the outcome rating scale is something that's used in our CAM services. Commissioners like to see that. So our arts partner said, yeah, you know what, we can work that really well in our services. And then we also have a WebWebs that I think everyone will be familiar with, that we use in national metrics, that's well recognised. But we also know that the experience data is really important. So the case studies and the focus groups and stuff. So we said that minimally we should be collecting at least one of those. And then we also know that our creative outcomes are equally just as important. So what have we got within there that we can show from our creative side? So we've got some great examples about that, but sometimes that can be the performance at the end. That young person who was so shy at the beginning, couldn't really talk to many people, who's there then on the stage taking part in a drama. It's really, really powerful things like that we need to bring forward and evidence. So what's our next steps? Well, we want to build our relationships between the arts and culture and our colleagues within health, the local authority and schools. We also want to bring education. So CAT's created 2 training. One's an e-module that's for individuals to go on. And all that does is bring in some of the evidence and the science around arts and culture, and then what you can do as an individual person within the system. And then we've also got another training that's a live training that's really aimed at that strategic thinking. So as you're thinking about commissioning within your area, are you thinking about arts and culture and the importance of arts and culture and commissioning that? And then evidencing, so using that evaluation kit that I've just mentioned to you about evidencing the impact directly with children and young people. So we did, as I just alluded to before, the CAMS proof of concept, but also we're going to be working with our colleagues in trauma responsive system and the violence reduction unit and wellbeing about, okay, how do we work with our arts and culture partners with these young people who may have experienced trauma or may be on the pathway to be involved in violence, etc. So how do we actually bring it as interventions and positive support and strength based for these young people? I'll just go back. You're welcome to sign up to our community of practice. You could sign up to be an arts and culture and mental health ambassador as part of our programme and learn more about it alongside. And then we've got a great case study with Julie as well. That's for you to see. And any questions?
Thank you, Angela. Have you got, let's put in the chat the web address for people to request a copy of the kit. And the other thing I'd say is that we're working with Angela and the team on using the kit, again, sort of trialling it with our social prescribing pilots in colleges, and then hopefully with a social prescribing pilot in schools that we're going to announce fairly soon, which will give us both some evidence around the kit, but also start to collate evidence and to create an evidence bank of how arts and culture can really impact on children and young people's mental health, because we know that's what commissioners need to see. And one final little bit of information I'll give you here is we're also I'm working with the person-centred approaches team in the Health and Social Care Partnership, and we're looking at workforce development, and we are hoping to develop over the next couple of months a module for social prescribing link workers on the role of arts and culture, which we can offer as a free e-training resource to link workers nationally, as well as particularly in Greater Manchester, but it will be available nationally as a way of promoting arts and culture as an intervention. Has anyone got any questions or comments for Angela? She's put in the chat. We've got the link where you can request a copy of the kit and find out more information about the work as well. This is an area, I'm really proud of this area of work in Great Place, actually. I think it's been an amazing partnership. Any quick questions before we move on to Jerry and Jackie, who I can see are chomping at the bit and raring to go? Quite scary. Okay, well, we'll move on to you, Jerry and Jackie. I'll just introduce you. So we worked with Jerry Moriarty on Live Well, Make Art. So a really crucial, important part of Great Place, Greater Manchester. Jerry's an independent arts consultant and co-author of, I'll get to read this, Culture, Democracy and the Right to Make Art, which was published in 2018. So she's continued over many years working community arts, as well as being a consultant and a trainer and a writer in the UK, Ireland and internationally as well. Live Well, Make Art was a really important exploration of the role of grassroots practice in creative health. And Jackie Wood has collaborated with Jerry and with myself and with some of the other people in this room as well, and is the Artistic Director at Arts for Recovery, which is also known as ARC, which is a leading arts and mental health organisation based in Stockport in Greater Manchester, and the venue of the first ever Arts on Prescription service. Correct. Excellent, I got that right. Okay, which is something all these years later we are starting to really build on and run with, but it started with you, Jackie. So I'll hand over to both of you to give our final presentation for the session. Thanks a lot.
Hi, everybody. I'm just going to start off and then Jackie's going to join in. It's really good to be here today. Live Well, Make Art is a mutually supportive network of over 350 creative practitioners, experts in public health, arts and health commissioners, GPs, nurses, health researchers, those working in libraries, art galleries, grassroots neighbourhood-based community organisations, theatres, galleries and universities. You name it, we'll have you, who are committed to a healthier Greater Manchester, where all its people can share the benefits of engaging in and enjoying the arts and creative activities with each other. What we wanted to do in our Great Places programme was to trial ways of encouraging a social movement for health, which really is that big revolution that James was talking about, a social movement which involves everyone in thinking about the health of the nation through an arts-based approach. And our aim was to create an intersectoral, multidisciplinary space which stimulated learning, partnerships and new work. During the 2 years of the programme, we held 5 district-based events held in Wigan, Salford, Oldham and Manchester for professionals and activists. And we explored themes like loneliness, health in the workplace, motherhood and early years, and social change. And these were brilliant opportunities for people to learn more about each other's priorities and practices. We also ran 3 informal exchange projects in Tameside, Bolton and Wythenshawe, South Manchester, which enabled much more in-depth connections to be made In Bolton, for example, this has resulted in the development of an ongoing forum for health and cultural practitioners. I believe that these purposeful networking opportunities are essential for Greater Manchester if we are really to encourage innovative cross-sectoral partnerships. We were also able to offer 24 micro-grant awards of about £500, encouraging organisations and individuals to explore potential new approaches and partnerships. Now, these were very, very small sums of money, but they inspired wonderful programmes of work right across Greater Manchester. And Jackie is going to say more about this, but I would argue that investing just a fraction of available financial resources in enabling creative practitioners to carry out innovative action research is a systemic way to drive positive social change. Finally, we experimented with 2 hyperlocal neighbourhood projects in Brunswick and Ardwick in Manchester and Hollinwood in Oldham. These projects were co-designed with members of the community who identified as being in poor health, alongside local arts, heritage and health professionals. Both projects delivered a tailored programme of work to address health issues that the community believed important for the long-term health of their neighbourhood. Now, at events like this, it's very easy to get caught up in the language of social policy, of targets and metrics. But what I'd like to remember is an afternoon I spent with a women's group in Brunswick, listening to them describe the stresses and strains of their everyday lives, struggling to feed their children, caring 24/7 for elderly relatives and families, worried about their housing situation, and then just watching their faces as those cares and stresses fell away, dancing, making clay pots, writing poetry. And to hear one of those women say, "We went to the theatre. These things are not in working class communities. We think they're not for us, so we don't access them." This opened up our minds and imagination. Now we think the arts are for us and are for everyone. Health equity in Manchester, in Greater Manchester, is as much about our minds and our imaginations as about our bodies. Now, I was asked to talk about what happens next for Live Well Make Art, but to be honest, I don't know. The network has operated mainly through volunteer efforts so far, and that just isn't sustainable. But what happens next for Live Well Make Art isn't really very important. Purposeful networking opportunities, investing resources in action research by creative practitioners, co-designing with communities, that's actually what's important. And any organisation committed to the social glue agenda could make a commitment to one or to all of these actions. I'm going to hand over now to Jackie, who's going to tell you a little bit more about what it actually looks like in practice. Jackie, over to you.
Thanks, Jerry. Thanks. So, yes, ARC was involved in 2 Live Well Make Art projects, as well as leading the Stockport Culture Champion scheme with some Great Place funding and being a pilot for one of the GM I Thrive Toolkit projects that Angela was just talking about. So we were pretty immersed in Great Place schemes, possibly more than most. And not because I just like to clean up on opportunities, but because I really do recognise the value of piloting ideas, having conversations with potential partners and research and development. That's at the core of our work. At ARC, we call this area of our work the Forge, which is a bit of a grand or possibly pretentious title, but it really helps us, the Forge, to articulate the vision that we have for perhaps reaching into a new geographical area, or working with new beneficiaries, or forging a new relationship, which might, just might, lead to a piece of work that we hadn't anticipated before. The fact is, even though we've been around for 25 years, we don't know everything and we don't know everyone. Services develop, and so should we. So Forge projects have led to amazing pieces of work for ARC and to long-term programmes, and they've also led to dead ends, which is almost as useful. So I totally agree with Jerry on the kind of valuing and investing in action research and networking. So the Live Well Make Art micro commission that we did, that was a few £100s, basically involved us listening to the experiences of women who struggled with their mental health. A particular focus was on mothers, some of whom had had children removed from their care. And we asked them about the role creativity could play for them. And we did it whilst we all sat around the table making sculptures with our hands. So it was a great way for natural conversation to flow, and didn't feel forced at all. So that piece of research was inspired by a touring exhibition that we created with the artist Sarah Greaves, the exhibition called The Other in Mother, which featured at one of the Live Well Make Art events in Oldham. But those conversations with the women truly helped us develop our existing Creative Mums programme into a much broader engagement programme for women and for families, which we're now running in partnership with Gallery Oldham, as well as at our base here at the Hatworks building in Stockport. So as a direct consequence of those little conversations, we've been able to extend our delivery. The other project that we did with Live Well Make Art was called The Art of Living Well in Tameside. I do like a grand thing. And I'm kind of saying it very tongue-in-cheek because we worked with staff at GPs practices in Tameside, and we undertook a pilot project for their patients. I think we were responding really to clinicians telling us, as James said earlier, that many of their patients were regularly attending for non-medical needs. But it's fair to say that not everything on the project went to plan. In fact, when I had to present about this at the event at the end of the kind of funding period, I found it really uncomfortable, even though many people, and you, Julie, seemed to find it quite entertaining. My stories of people not turning up and trying desperately to find patients to work with. But the positives of the project were really clear. So the healthcare staff absolutely loved taking part in creative activities themselves. They immediately felt the benefit for their own mental health, and they saw how it could support their patients. So that worked really well. The main GP that we were kind of negotiating with, she did pottery in her spare time on her non-working day. So she completely got it. So staff creativity equaled staff well-being, equaled staff buy-in. So they were advocates for the project. So that was great. That worked really well. But other things didn't. So assumptions were made about the venue, that it would be good to have it in the GP surgery, when actually it was not a good environment for the activity for all sorts of reasons. Our base, where I'm in the pottery room here in our base in Stockport at the moment, but we have total control over the space, over control of how it's presented, how we welcome people, how we reassure them, how we surround them with artwork that's made by people who've shared experiences with them, by ex-participants, welcoming them as volunteers in the centre. We work through the physical journey for each participant. You know, we talk it through them. How are you going to get here? Or work that through. And we also, I think, present a venue that feels more cultural than medical. So in the end, a medical venue didn't work for that particular project. The other thing was that the support needed for somebody to attend an arts project for the first time, I think that was underestimated by all of us. The healthcare professionals, the GPs, were referring patients who were not engaging with other offers. And actually, most of them didn't engage with this one either. So on reflection, we were kind of setting ourselves too many challenges in a very, very tight amount of time. Again, when it's in ARC studios, we have lots, in our programmes in Stockport, we have lots of mechanisms for supporting participants to make that daunting and difficult initial journey. You know, there are informal visits, there's phone calls, there's text reminders, all sorts of things. We can't presume people will come just because it is good for them. So in new partnerships like the one in Tameside, you know, where was that support going to come from? And the fact that we'd not planned that in properly was perhaps a mistake. In Stockport, we've built very rich referral networks, including through the CCG, through health visitors, community mental health teams, the DWP, and through Viaduct Care that Jaweedha was speaking about. We've got a network of locality-based professionals who signpost people onto our services, and we've got good relations with public health. So all of that works pretty effectively. But in order to offer our programmes more widely, geographically, the challenge really is in finding the right ways to reach the people that we want to engage with. It's not easy finding out who you should be talking to in a mental health team, and getting hold of GPs or practice managers. can feel nigh on impossible. It takes a lot of research, meetings, emailing, often with no response because people are completely overwhelmed. But in order for our service to be effective, we have to get the health buy-in. We have to get that value and real partnership. The health sector needs to be able to trust in our offer because they understand how it works over time and they've seen its efficacy. Arts organisations such as ARC can offer something that we know supports people, and we've got the evidence, anecdotal and statistical, but it doesn't happen overnight and it doesn't happen in isolation. Our offer is holistic. We aim to connect people to mental health support and community projects and other services rather than keep hold of them. The idea is they come to us and then they go out. So navigating the health system and finding the most appropriate people to contact, yet alone finding suitably accessible and welcoming venue, as well as developing supportive referral pathways, all of that takes time. I would say months of lead-in before a project can really be effective. However, that might sound a bit doom-laden. I just think that those are the things we've learned from those, short pilot projects. And right now, I do actually feel quite hopeful. As Clive was saying, I see a much greater awareness and acceptance of the benefits of arts participation and arts experiences to health outcomes. And certainly ARC, we have more health partners than ever before. The project in Tameside might not have been as successful in all the ways we'd hoped, but it did remind us of what needs to be built in order for the arts and health to work cohesively together. A positive outcome of our project with the proof of concept for the GMI project with young people is that we did a short 3-month piece of work for that, but now we are the main delivery partner for a new service for young people in Stockport, which we're working with Beacon Counselling on, so we tendered for that together. And it's an early help service. There's a single point of access, a wide range of referrals coming in, and they're coming into a service which offers a creative programme as a key part of that project, not the icing on the cake, not the thing to the side, but actually at the heart of the offer. So pilot projects, research, partnership development, and embedding an arts project within a health ecosystem really can lead to ongoing developmental programmes rather than short-term delivery. We think it's long-term relationships which deliver. That's the way it works for me. And finally, just following on from Clive's passionate point about the arts helping us make sense of the world, which is a phrase I often talk about, I just want to do a shameless plug for a project. So I'm sure you're all free on Saturday, this coming Saturday, but we are launching a project called Stockport Together Again at the Stockport War Memorial Art Gallery. And it's we were commissioned by the council to develop a project that enabled people to come together and share the creative ways that they have kept connected and hopeful. So there are community projects, there are culture champions projects in there, there's there's postal art projects that we've run, but there's also loads of artwork from people, artists and people who wouldn't consider themselves artists who've submitted work, and we've taken over the whole gallery. So it's wonderful. There's going to be an Arts and Health Week. There's all sorts of things. So I'll put in the chat. It's just basically go to our website and go to the home page. You'll find the information on Together Again. It's open till the 14th of November. So I'm kidding. I'm sure you're all very busy on Saturday and you can't come. You'd be very welcome to come on Saturday, but then it's open Thursday, Friday, Saturday, Sunday till the middle of November. So Clive, if you're allowed to be out and about, that's my positive thing to come and do. Come and just be inspired by what people have created. And how they've kept connected. Thanks very much.
Thank you so much, Jerry and Jackie, and thank you, Jackie, for your candid description of what works and what doesn't. It's so important. We very rarely talk or listen to people about what hasn't worked, and it's the most important thing I think we can possibly talk about. We're coming right to the end of our session. I don't see any hands up, so I'm just going to give a couple of little bits of summing up, really, which are more information than anything. It's been amazing to work with all of the people who've spoken today, and I'd like to thank you also. Thanks to James and Jaweedha, Clive, Angela, Jerry, Jackie, and also to Claire and Ali, who've been supporting behind the scenes. we have a website. We haven't been able to talk about a number of strands of the culture, health and wellbeing sort of theme of Great Place. And to be honest, a lot of that work just runs through every single bit of work we've been doing over the last 3 years. Next week, we have the second of our events on creative ageing, which obviously intersects with the culture, health and wellbeing work, but we're very careful and clear that ageing is not necessarily about health, it's about ageing. So, Jackie mentioned Culture Champions. ARC's been involved in that. That's a large-scale volunteering and activism program around creativity and ageing well. So about older people becoming producers of culture and making sure that the cultural offer is age appropriate. So we'll be talking about that next Thursday. We have a website. Which I've just put it in the chat. So this, I'm going to share my screen really quickly for about 30 seconds. Let's see if I can, here we go. So here is our website. I wouldn't say we're launching it today. It's going live today. It's incomplete. It's an archive of all of the projects that we've done, all of the case studies. There are about 13 case studies. You can investigate all the case studies, find out more about all the projects, and more importantly, the learning that we have generated. There are the 4 themes. You can click through to culture, health and wellbeing. This section is more or less complete. So everything we've talked about today, the case studies, there are 5 case studies there. There is an overarching video about the theme, so you are more than welcome to start digging around in there for more information. As we go through each of the themed events over the next 4 or 5 weeks, we'll be making sure that that section of the website is complete. We're going to be taking a lot of the work we've been talking about forward, both in the combined authority and for the Health and Social Care Partnership when it becomes an integrated care system next year. So it is exciting times for us. So I'd like to say thank you all very, very much for attending. It's quite emotional seeing this part of this work coming to a kind of, at least a pause, a conclusion. And I'd like to invite you all to participate in our work going forward, particularly around conversations around a social glue and how we support the people of Greater Manchester to live healthier and happier lives. So thank you very, very much for everyone for attending. Thanks a lot. Bye-bye.